Hi, I'm Drake MacArthur, and I'm one of the chief residents at Tulane Hospital.
Hi, I'm Stephanie Goddard. I'm one of the R2 residents here. We're here at Tulane Medical Center, the flagship hospital.
And hi, my name is Amy Yu, and I am one of the R1 residents. And now we're going to give you a tour of our radiology department.
So we're standing here in one of our interventional radiology cath lab suites. Here at Tulane, we utilize up to 4 to 6 rooms at any given time with a variety of procedures. Something exciting for our program is that we recently launched an ESIR program that's led by our ESIR program director, Dr. Boardley. And we've actually just started integrating some of our residents into that starting this past couple of years. So those opportunities are definitely available here at Tulane. In addition to the facilities that we use here at Tulane, we also go over to West Jefferson, another area in hospital. One exciting thing that we do here is a variety of procedures from bread and butter kind of stuff, all the way up until very highly specified procedures such as a Y90, taste procedures, all the way up to CT guided things such as RFA ablation. So we're all very excited kind of about the variety that there is to offer for both our diagnostic and interventional curriculum.
Downtown we have a 3T and a 1.5T magnet. At our Lakeside location we have a 1.5 magnet, and also at our Uptown location we have a 1.5 magnet. So between all of these magnets we do a lot of imaging, both adults and pediatrics. We do large and small joints, we do breast MR, we do a lot of neuro, we do a lot of cancer staging, including in the neck, chest, abdomen, and pelvis. We do a lot of prostate MRI, we do a lot of liver studies, including iron quantification and liver elastography. We also do a lot of aortic dissection and aneurysm follow-up imaging. We do breast MRI. So between these locations, you're constantly busy.
So here at Tulane Medical Center, we have several CAT scans. Over in the downtown campus, we have 3 of our CAT scans, and then also we have one at one of our other hospitals, Lakeside Hospital. So for our CT, we have our standard CAT scans. We have like a big comprehensive stroke center here, so we get a lot of neuro CTs. And we also get a lot of transplant patients, so we do a lot of CT post-transplant imaging. And then also we do a lot of the CT guided procedures in here as well.
One thing we're really proud of here at Tulane is our high volume women's imaging center. From normal mammography to breast MRI, we kind of see it all. We do daily breast biopsies, both regular and stereotactic, between here and Tulane Lakeside. And a great plus to our program is that other than MSK, we don't have any fellows. So all of those procedures are left to the residents to do. We're also really excited that we offer 3D tomosynthesis here. It's an entirely different modality that we're able to offer to our residents as they learn.
Here at Tulane Medical Center, we do a lot of transplant procedures. So this is one of our ultrasound rooms in here. So we read and see a lot of ultrasounds for transplanted livers, pancreas, and kidneys. And also, as residents, we use this room so we can practice scanning our organs. That way we can figure out the techniques that our technologists use and be able to help out with that. And also we do ultrasound guided biopsies here as well. For every rotation, each resident gets their own workroom. So for example, this is our workroom for ultrasound. We have an ergonomic chair so we can get comfortable. We have our PACS system as well as Power Scribe where we can dictate our reports. And each desk is able to be moved up or down, so you can transform this into a standing desk. And then some rooms are cold than others, so we always have heaters nearby.
One area that our residents get to use almost daily is our fluoroscopy suite. Whether you're on MSK, neuro, chest, body, we kind of have a lot of procedures that we do in this room. On MSK, we'll do both therapeutic and diagnostic joint injections. For neuro, we do myelograms and LPs almost daily. We also will do everything from swallow studies to barium enemas right here. So We really get very familiar with using fluoroscopy and get really comfortable with that throughout our residency.
Here in the nuclear medicine department, we have a brand new SPECT CT scanner. We also have a gamma camera scanner. At our Lakeside location, we have a brand new SPECT camera, and we also have a lot of new imaging at the CH NOLA location. In nuclear medicine, we have our bread and butter bone scans, gastroparesis studies, etc. We also do a heavy volume of PET CT imaging, and upwards of at least 10 PET CTs per day. You're very, very busy on this rotation, but it's a great experience.
So here's another one of our reading rooms. This is in nuclear medicine. We have a high volume of PET CTs each day to go through, in addition to a lot of cancer imaging, including nuclear medicine bone scans. Very busy rotation, but also very rewarding.
Sometimes it's the little things that make a residency. Here at Tulane, our residents like to hang out in our call room. We can study here. When we take call, we can hang out in here. There's a bedroom right attached. And it's just, in general, a great place to hang out or even get a massage.